So Mayo Clinic states that an ingrown toenail occurs when the edge of the toenail grows into the surrounding skin, causing pain, redness, and swelling. Now, this is actually not an uncommon occurrence for many infants. I mean, I can go back to when my son's toenails were growing, and they were just like crazy and gnarly. They're funky.
Yeah.
He actually struggles with ingrown toenails, and he's not a clubfoot cutie. So again, it's not that it's an uncommon occurrence for a clubfoot cutie, but also not uncommon for someone without clubfoot to have. So, but it's typically on the big toe in particular. And what your kind of red flags would be is if you start to see almost like a little bubble on the outside of the big toe, or even inside of the big toe, and it's starting to look red, like it's festering something. And then sometimes if it does get to the point where it is truly an ingrown toenail, at that point you can also see some of that pus come out of it if it does end up breaking that skin. So it can be a little nasty and an ugly little toe, but not uncommon even outside of the clubfoot world. So first line of defense is just proper nail trimming, and it's kind of like that baby hair that comes in and you're like, oh, that one's been there since they were born, and I think I need to trim it just so that it evens out. Same thing with their toenails. It is a wild process for toenails to come in, but making sure that you're trimming those toenails just straight across. Avoid cutting them too short as well. The other thing that can potentially lead to ingrown toenails is if your sock is really, really tight up against the toes. That can also prevent the toenail from actually growing. So when you're putting on the sock, if you're struggling with ingrown toenails, just give it a nice little tug so that there is just a little extra material at the end of the sock to just allow for that normal growth. So monitoring for early signs is checking just the toe at each time that you're bathing them, and just making sure that we're trimming the toenails as soon as you can, not letting them get too long or too short. Too short is really the reason why that sometimes you get the ingrown toenail. If you feel as if the boot is actually causing the issue and it is not resolved with proper trimming of the toenail, just be sure to schedule an appointment at that point with your care team, and we can just assess the fit of the boot. In most cases, it's not necessarily the boot potentially causing that, and it just is just something that you mentioned is just adjacent to potential skin anatomy or genetics, all the fun things. So this might end up falling out of the scope of the orthotist or your AFO provider's scope of practice. So your cutie's orthopedic physician, whether it's your pediatrician or a referral out to a pediatric podiatrist, those might be some avenues for support in these cases.
I do think it's important for you to just remember that all babies have different sort of varying levels of issues when it comes to skin, toes, that sort of thing. One of the things that I found for us was hard. I mean, you get these little baby toenails and you're first of all, my kids, I if you followed our story too, our cutie's toenails were wild for a long time. It's even now, she's been out of boots for probably a year and a half now, and they're finally starting to kind of normalize and look normal. And I'm but a lot of the times they're kind of curved up. They do kind of have a little bit of a different vibe than other babies' toenails. And so we found that if I couldn't clip them, I would use there's these S-file nail files, and I would use that to kind of just maintain the shape of it without having to feel am I going to clip it too short? It's like when you have your pet, and if you've ever tried, which I never do, but try to trim their nails and you're oh, is it going to bleed? Am I going to do it too short? So the nail file just gave me a little bit more of okay, I can do these in smaller increments without feeling I'm going to do too much damage, right? That's the balance for parents too, is being I want to make sure that I'm doing the right thing, but not overdoing it. So how are we finding that balance?
That's a great tip. I didn't even think about that. I'm going to put that back here and have that for my clinical practice too. That's great.
It's crazy. It's crazy the amount of little things they make for little babies that you don't but sometimes you have to search. You don't know about it until you search for it. And you're like, oh, that was actually very helpful versus other avenues. So yeah, that was one of the things that we use to kind of maintain her wonky toenails, which are better, guys. So just if you're having concern about the toenails, it does get better. Okay. They will start to even out.